We're now joined by Shabnam Salih, who is Director of the New Jersey Office of Healthcare, Affordability, and Transparency. Shabnam, thank you so much for joining us.
Hi, thank you, Steve. Thanks for having me.
Tell everyone what your office is and why it matters now more than ever.
So the Office of Healthcare Affordability and Transparency, the governor set up, shortly prior to the pandemic, but now more than ever to the point, you just highlighted the COVID pandemic has had a devastating impact, but taught us many things. And now more than ever, recognizing that access to affordable, quality healthcare is critical, not only for the health and well-being of our residents and families, but to our broader communities and to our economy. So setting up this office in the governor's office was really an opportunity to double down on the administration's healthcare and affordability work so that we can make sure more of our residents, businesses, employers, all those who are purchasing health benefits have access to more affordable quality care.
How is this related to the Get Covered NJ initiative being extended throughout the end of the year? Tell everyone what that is. We'll put the website up so we can be involved in an important public awareness effort. Tell everyone what it is and why it matters.
Yeah, absolutely. So our Department of Banking and Insurance, this year we launched the New Jersey's own state-based exchange, and we've done a number of things in the individual market that have ultimately helped bring premiums to lower today than they were when the ACA was first implemented. So a whole host of policy changes and programs that have implemented that have really made a significant impact on affordability for New Jerseyans who are purchasing on the individual market. So again, there have been a number of things that the administration has led in the individual market through our Medicaid program, through our state health benefits and school employee health benefits plans. And these have made a significant impact in providing real consumer relief in the short term. What we're also working on is something called the New Jersey Healthcare Cost Growth Benchmark Program, which is a mouthful, I know, but it's really a program and an opportunity for us to take a look at healthcare affordability work in the long term. So we recognize that consumers need real relief and support now and in the short term, and Get Covered New Jersey is a great way to connect more New Jerseyans to affordable healthcare. So for anyone who is uninsured or underinsured or wants to do some,
it'll be on the screen. What happens when they go to the site, Director?
So a number of different things. If you're uninsured or underinsured, or you want to shop around, there are different tools on there where you can compare different types of plans, learn more about your options. We have, for the first time, state-level subsidies that have helped make these plans more affordable for more New Jerseyans. The American Rescue Plan, which the federal, so there's new funding and subsidies available from the
new federal dollars.
Yep, that have made a huge impact in lowering premiums for a lot of residents as well, both in New Jersey and certainly across the country.
There are a lot of executive orders, and some of them are very hard to follow in terms of what they're for and why they matter. Executive Order number 217, signed on January 28, 2021. What is it? And please tell folks why it matters to them directly.
Sure. So, Steve, you highlighted Get Covered New Jersey, which is really about getting folks connected to the coverage that they need today and that they need in the short term. Executive Order 217 did a couple of different things, really focused on how is it that as an administration we can continue to support and make real progress on affordability and accessibility measures in healthcare for all those that we need, that we know need it. One of the primary things that the executive order does is it sets us up on the path to developing a healthcare cost growth benchmark or a target, whichever you want to call it. And what the benchmark is really it's a simple idea, but I think it's a really bold and big idea. And what the premise it's certainly focused on is that healthcare costs have grown too quickly. They
Much
are
greater than the degree, sorry for interrupting, Director, at a much greater rate, at a much higher rate than wages, clearly.
Than wages, than folks' income, than the economy. And we know this is unsustainable. We all must have someone in our lives or someone we know that has struggled with the cost of healthcare, whether it's purchasing coverage or out-of-pocket costs or their co-insurance. So we know this rate of growth is unsustainable. Healthcare is feeling more and more expensive, whether you're a family purchasing it for yourself, whether you're an employer wanting to, attract and retain a competitive workforce. It's getting more and more challenging. So with
Got
the
30
benchmark
seconds left. So what happens with this executive order and what impact will it have?
So what the benchmark program does, it brings us all together to set a common goal around how much healthcare costs should go up from year to year. We take a look at that benchmark and then we measure ourselves against that benchmark to see how we're doing. So it allows us to get a hold of the data, and we are able to use the data and transparency as a tool to understand what the cost drivers are, develop real solutions and strategies to address the most significant cost drivers and issues we see. And it really sets up, I think, for the first time in a long time, a really strong foundation for healthcare affordability work in the state for not only in the short term, but the long term as well.
Could not be a more important initiative impacting millions and millions of people, not just in New Jersey, but across the nation. Director, thank you so much for joining us. We appreciate it.
Thank you for having me.
We thank you so much for watching, and make sure you see us next time.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by Johnson & Johnson, the Robert Wood Johnson Foundation, the Healthcare Foundation of New Jersey, the New Jersey Economic Development Authority, the Northward Center, the FIDELCO Group, NJM Insurance Group, Choose New Jersey, and by Caldwell University. Promotional support provided by AM 970 The Answer and by New Jersey Globe.
Hi, I'm Abby. You might see me as an ordinary person, but I've been living with a brain injury since 2018. Opportunity Project gave me hope, and I've gained confidence through job skill training and helping my family. Despite my challenges with memory, I see a possibility to keep improving.
If you have a brain injury, you don't have to face your road to recovery alone. Learn more about Opportunity Project and its partnership with Children's Specialized Hospital.